Welcome back to the Doc Talk podcast. I'm Dr. Shazma Mithani.
And I'm Dr. Sheila Wijayasinghe.
A special thank you to our episode sponsor, Figs. So obviously in our line of work, you kind of live in your scrubs. I certainly do. And if you follow us on Instagram, you probably already know this by now. We are obsessed with Figs. They're super comfortable, breathable, durable, and they actually fit well, which is just a huge upgrade from the horrible, itchy scrubs that were status quo for so long. They're also really cute and stylish, so you just feel good wearing them, you know?
Yeah, and like you said, Shaz, we're kind of obsessed, and you know what I love most about Figs? They just get what it's like to work in this field. It's not just that they know that we need 7 pockets to carry around our stuff on shift. They also build this incredibly supportive community of people who want to have the most important discussions and make real connections with other people who work in healthcare. I've been to some of their events they've done, and it's so refreshing for a brand to show up in such a real way. And if you guys aren't following them on social media, their memes and their social media products are amazing. If you work in healthcare or know someone who does, Figs is it. And right now, if you go to wearfigs.com and use code FIGSCA, so FIGSCA, you can get 20% off your first order. That's wearfigs.com, code FIGSCA. So Shaz, in our last episode, we talked about fever and why it happens, why it can be really anxiety-provoking, when to worry, and when to take a deep breath and let the body take care of it's doing its own thing and taking care of yourself.
And today, as promised, we're diving into one of the scariest moments for any parent, when their child has a seizure during a fever. We're talking about febrile seizures today, what they are, why they happen, what to do in the moment, and when to get help. Let's start out by a listener question from Nancy.
Hey Doc, this is Nancy, huge fan of the podcast. I just had a question for you. My 18-month-old just had their first febrile seizure, and it was super scary. I'm wondering if you can walk me through what to look out for in the future, if I should worry about the future risk of this, and any other advice you might have about this. Thank you so much.
I hear you, Nancy. One of these things, whenever we see kids back in the office, often people are going to the emerge test to see you first before they come to see me as in family practice. But when I see these families back in my office, there's a lot of understandable fear. So I'm really glad that we're breaking this down for parents so that they can get that advice and reassurance during this episode. So really, we should start with what is a febrile seizure?
Yeah, just so our listeners know.
So let's level set. A febrile seizure is a seizure that happens in young children, usually between 6 months and 5 years of age, that is triggered by a fever.
So that is the classic definition of febrile seizure, and often something that I tell parents as well, just to kind of let them know what to expect and when it can happen. But importantly, febrile seizures are not epilepsy. That is always a concern that I have when parents come in with their child with a febrile seizure. They're brief, fever-related events caused by a child's developing nervous system that's reacting to a rise in the body's temperature.
And they're super common, right, Shaz? About 2 to 5% of kids will have one in their lifetime.
When I'm working in the pediatric emerge kind of during the classic respiratory virus season where kids tend to get a lot of fevers in those winter and fall months, I mean, it's not uncommon for me to see 1 or 2 kids with febrile seizures per shift.
Oh, really?
So, yes, absolutely. So I think it's important, again, to reiterate that it is very common. Like you said, up to 5% of kids can have one in their lifetime. One thing that I really want to dive into is why they happen, because I think there's a lot of, concern, understandably, and misconceptions about why febrile seizures happen. And so they do tend to occur because a young child's brain is still developing and much more sensitive to sudden changes, especially a quick rise in temperature.
Absolutely, Shaz. It's actually that jump in temperature, not how high the fever gets, that actually triggers the febrile seizure. It's just that the nervous system is overreacting in that moment to that rapid rise, not the actual number.
I like that. Like a brief kind of overreaction in a developing nervous system. It just, the way that I kind of explain it to parents is that the temperature goes up really quickly. The child's brain doesn't really know what to do. And so it overreacts and has a seizure. And it's really important for parents to know that these seizures, although they're extremely scary to watch, they're almost always harmless.
So you say this much more often than I do, Shaz, because parents are coming in directly after they've had their kiddos had a seizure. But let's talk a little bit about what they look like. So most febrile seizures are what we call simple febrile seizures. So the child becomes stiff, they may shake on both sides, roll their eyes back, and then go limp or become quite sleepy afterwards. And they last less than 5 minutes for the vast majority.
Sometimes there can be tongue biting. There can be urinary incontinence, which means that they might pee themselves as well. And so those are things that I kind of ask parents about as well. So on the contrary to what we call simple febrile seizures, like you said, there's something called complex febrile seizures. And so they can last longer than 15 minutes, happen more than once in 24 hours, or it's what we call a focal seizure. So they involve just kind of one side of the body rather than the entire body. These are much less common. And if they do occur, we take a much closer look in terms of why they happen, maybe more inclined to do investigations, get some consults, and maybe admit the patient to hospital as well.
Oh, that's really important to distinguish between that, because that'll just influence how you treat these patients as well. It's really important to also note that your kids, after having a seizure, will be very sleepy. So that post-seizure sleepiness is called the post-ictal phase. And that can last up to an hour and is very normal because the brain has basically just gone really quick, super activated, and then back to its normal state, but it's very tired. Okay, Shaz, so I want to hear from you. What do you tell parents what to do if they're witnessing a seizure? Like, this is understandably a very scary thing to see your child not respond to you, have these body movements. It's terrifying. So what do you tell parents what to do in this moment?
This is such a great question because it really is important for parents to know what to do. And the most important thing is to keep the child safe. And so if you notice that your child starts having a seizure, lay them on their side on a flat surface, anything that's around them that like a moving or seizing limb could hit and injure them. Make sure that the entire area around them is clear, and just make sure that they're on like a flat surface, not on anywhere where they're at risk of falling off of either with the seizure.
Oh, that's really important. People will often ask, like, should I stop anything in their mouth? And so, no, you don't put anything in their mouth, no food, no water, no fingers, and don't try to hold them down. I think sometimes we would naturally react to try to like hold them or hug them because they might seem like they're scared, but don't hold them down. We have to sort of let that seizure run its course.
And another important one, time it if you can. I know that this is a really scary moment, not necessarily the front of mind in terms of like timing it, but like just take a quick glance at your watch. It's helpful for us to know how long the seizure has lasted for when you come into the ER. And of course, as soon as it starts happening, call 911 right away.
Once it's over, make sure that your child is breathing comfortably and starting to wake up. Then you can gently place them on their side and just be with them, because when they wake up, they might be a little bit confused as well.
So let's talk a bit about risks and prognosis, because again, I think a lot of parents worry not only about the febrile seizure in the moment, but what that means in terms of like long-term prognosis for their child. About 1/3 of kids who have one febrile seizure will have another one in their lifetime. And that's because some kids are just more prone to having febrile seizures.
And here's the reassuring part about this, and I think this is where parents often ask me in their family medicine follow-up. The reassuring part is that most kids will outgrow febrile seizures by the age of 5 or 6. They do not cause brain damage, and the long-term outlook is excellent.
I often get the question as well, like, is there an increased risk of developing epilepsy later on? And it is like slightly higher than the general population, like ever so slightly. So instead of 1% with the general population, if your child has had a febrile seizure, the risk of developing epilepsy goes up to like 2%. So it's not a significant increase. It's still very low.
So for the vast majority of folks who have febrile seizures, this is a temporary, harmless response that passes with time. So parents will often also ask us, what can they do to prevent a febrile seizure, which is where I get a lot of these questions, Shaz, and I'm sure you do too, because once you've witnessed this, you do not want to witness this again, understandably. But the short answer to this is that there's not really anything that we can do to prevent these febrile seizures because, again, it goes back to the first comment that we made earlier on. It's not necessarily the height of the temperature or the number that's on the thermometer that we're trying to treat. It's that rapid rise in temperature that seems to be triggering this febrile seizure, and that's hard to predict. And so treating the fever with acetaminophen or ibuprofen can make your child more comfortable, but it is unlikely to prevent a seizure.
I think that's a really good point because that is a very common question that I get. Like, if I just continue to give my child fever medications, will it prevent a febrile seizure from happening? The answer is no. And a lot of times what I actually see in the ER is when, like, by the time a parent comes in, that's when the fever is actually measurable. Before the child had the seizure, there was actually no measured temperature. And it's because, like you said, it rises so quickly that it's like not even initially detectable because that temperature is normal. It goes from normal to elevated and not normal so quickly that there really just is no role in giving any anti-fever medications. We also don't use any anti-seizure medications for just plain febrile seizures because the risks outweigh any sort of benefit they might have.
So really the focus for febrile seizures, there's no real treatment for it or prevention, but we really do focus on comfort, fluids, rest, and a large dose of reassurance.
Always important for our listeners to know when to see a doctor. So every child who has their first febrile seizure should be assessed by a doctor.
And absolutely seek care if the seizure lasts longer than 5 minutes, if it happens more than once in a day, if it only affects one side of the body, or if your child doesn't recover normally afterwards, going back to that complex seizures that you mentioned earlier, Shaz.
And of course, if your child is under the age of 6 months, is immunocompromised, or you just, again, we said this in our episode on fever a couple weeks ago as well, if you just have that gut feeling that something doesn't feel right, trust your instincts and get your child checked out.
Okay, let's do a quick recap of today's episode by doing a true or false on febrile seizures.
Awesome. Let's get right into it. So Sheila, true or false, febrile seizures can cause brain damage?
False. So they're scary, but not harmful in the long term. True or false, febrile seizures happen because the fever is too high?
That's false. So it's not the actual height of the fever, but it's the rise and the speed with which that temperature rises that is thought to cause febrile seizures. True or false, most kids who have febrile seizures will develop epilepsy?
False. The risk is still very low. True or false, giving Tylenol or Advil can prevent febrile seizures?
So that one is also false. Antipyretics or anti-fever medications will not prevent febrile seizures from happening.
So to wrap up, Shaz, let's do a little prescription for our listeners. Our prescription for you around febrile seizures is to always remember that febrile seizures are common and almost always harmless. Focus on safety during the seizure. So clear the area, call 911 if it goes beyond 5 minutes. Don't put anything in your child's mouth and give them comfort measures after the seizures have happened. And third, after your child has had a febrile seizure, especially if it's the first one, make sure that they are assessed.
And in this new little segment that we're going to start, there are some things that we also want healthcare workers that are listening to know about febrile seizures. So whether you're a learner or someone who is not necessarily in the ER space, here are some big important take-homes for febrile seizures for healthcare workers. So number one, the definition of a simple febrile seizure is that it's generalized, lasts less than 15 minutes, and occurs once in 24 hours in children who are between the ages of 6 months and up to 5 or 6 years old. Number two, no imaging or anticonvulsants are needed for simple cases, and often blood work is not needed either. Just reassurance and education are key. And number three, antipyretics do not prevent seizures. We treat the fever for comfort only.
So thanks for tuning in today, and know that febrile seizures are one of those terrifying but usually benign childhood events, and we are here to support you. So please do keep on sending us your questions because we'd love to answer them in a future episode. A reminder that the Doc Talk podcast is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your own personal health needs. Please be sure to follow us on social media at the Doc Talk Pod and send us your questions.